In this video, we will discuss how we interpret complete blood count results. In CBC lab test, we need to know these subtypes, which are hemoglobin, hematocrit, mean corpuscular volume, or that can be abbreviated by MCV, platelet count, and finally the white blood cells. The reference range in hemoglobin differs between male and female, which is lower in females, and please search to know why. This will be discussed in our simulation pharmacy, inshallah. And as we know, decreasing hemoglobin level below the reference range can be interpreted as anemia. Anemia by itself is not a condition, it's a symptom connected to certain disease or condition. The reference range for hematocrit is also lower in females than males. Decreasing the hematocrit level below the reference range can be interpreted as anemia. Now, one of the most important tests that we can use as a differential test in anemia, in which I can define or predict the cause of anemia, is the MCV, or the mean corpuscular volume. The MCV reference range is between 80 and 100 femtoliter, in which if decreased lower than 80, it correlates with microcytic anemia, which is mainly caused by iron deficiency. But if MCV is upper than 100 femtoliter, it correlates with macrocytic anemia, which is mainly caused by B12 or folic acid deficiency. For platelet count, the reference range is between 150,000 and 450,000, in which the value, or if the value was upper than or higher than the level, this called thrombocytosis. And if it was less than the normal range, this called thrombocytopenia. Please search about these conditions and what may cause the thrombocytopenia and the thrombocytosis to be discussed in the simulation pharmacy, inshallah. And that at the end, the white blood cells, or the reference range for white blood cells, is between 4,000 and 10,000 cells. Decreasing the white blood counts between the normal range is called leukopenia, and it's related to either bone marrow suppression or chemotherapy treatment. But increasing of the white blood cell count above the reference range is called leukocytosis, and it's related to infection. Please search about the white blood cells differential that can be used to interpret if the infection is viral, bacterial, or parasitic, to be discussed in the simulation lecture, inshallah. Previously, we talked about anemia and its interpretation, and we mentioned that the MCV could be used as differential to determine the reason of anemia. If the patient has a low MCV, the cause may be iron deficiency, and if it's a high MCV, the cause may be B12 or folate deficiency. Now we will talk about B12 and folate deficiency, in which the normal range for B12 readings will be above 300 picogram per milliliter, between 200 and 300 picogram per milliliter. This will be on the borderline, and it will be considered as a deficiency if the reading is less than 200 picogram per ml. And the normal level for folic acid is above 4 nanogram per milliliter. If the reading was between 2 and 4 nanogram per milliliter, this will be considered on the borderline. Less than 2 nanogram per ml, this will be deficiency. The deficiency symptoms are fatigue, irritability, cognitive decline, and numbness. The causes of these deficiencies may be related to decreased intake of vitamin And please know if the patient is vegetarian, which type of anemia will be occurred for him. Another cause is decrease the absorption in case of intestinal obstruction, for example, medication and drugs. And please know which pharmacological classes will cause B12 and folic acid deficiencies. And the final cause is rare genetic disorder. Since folic acid deficiency is rare, we will mainly talk about B12 deficiency. So, if the patient has a symptomatic anemia, neurological symptoms, and possible malabsorption or concern about adherence, then we will give 1 milligram intramuscular cyanocobalamin as daily basis for 1 week. Then, for 3 weeks, we will give 1 milligram weekly and as a intramuscular injection also, and last we will give the patient once or one injection monthly. يعني بنعطي 1 ملغ يوميا لمدة أول أسبوع، بعدين 1 ملغ weekly لمدة 3 أسابيع، وآخر إشي as a maintenance therapy بنعطي 1 ملغ 1 intramuscular injection شهريا. And if the patient has not symptomatic anemia or neurological symptoms or possible malabsorption or concern about the adherence, then we can either give 1 to 2 milligrams of oral cyanocobalamin or 1 milligram on weekly basis for 1 month. But in both cases, we give 1 milligram monthly as a maintenance treatment. And please give example for B12 brands, dosage forms, strength, or the available strength in your hospital. And we will discuss this in the simulation pharmacy, inshallah.